Osteoporosis. Osteoporosis is a condition characterized by a decrease in the density of bone, decreasing its strength and resulting in fragile bones. This disorder of the skeleton weakens the bone and results in frequent fractures, breaks in the bones. It can affect both males and females, but it is most likely to occur in women after menopause, because of the sudden decrease in estrogen, the hormone that normally protects against osteoporosis. Normal bone is composed of protein, collagen, and calcium, all of which give bone its strength. As the bones become weaker, there is a higher risk of a fracture during a fall or even a fairly minor knock that normally would not cause a bone to fracture. The fracture can be either in the form of cracking as in a hip fracture or collapsing as in a compression fracture of the vertebrae of the spine. The spine, hips, ribs, and wrists are common areas of bone fractures from osteoporosis, although osteoporosis-related fractures can occur in almost any skeletal bone. Types of osteoporosis. There are 4 types of osteoporosis: primary, secondary, osteogenesis imperfecta, and idiopathic juvenile. 1. Primary osteoporosis. Primary osteoporosis is the most common type of osteoporosis. It is more common in women than men. A person reaches peak bone mass density at about age 30. After that, the rate of bone loss slowly increases, while the rate of bone building decreases. 2. Secondary osteoporosis. Secondary osteoporosis has the same symptoms as primary osteoporosis, but it occurs as a result of having certain medical conditions, such as hyperparathyroidism, hyperthyroidism, or leukemia. It may also occur as a result of taking medicines known to cause bone breakdown, such as oral or high-dose inhaled corticosteroids if used for more than 6 months, too high a dose of thyroid replacement, or aromatase inhibitors used to treat breast cancer. Secondary osteoporosis can occur at any age. 3. Osteogenesis imperfecta. Osteogenesis imperfecta is a rare form of osteoporosis that is present at birth. Osteogenesis imperfecta causes bones to break for no apparent reason. 4. Idiopathic juvenile osteoporosis. Idiopathic juvenile osteoporosis is rare. It occurs in children between the ages of 8 and 14 or during times of rapid growth. There is no known cause for this type of osteoporosis, in which there is too little bone formation or excessive bone loss. Causes of osteoporosis. Low bone mass is usually caused by a combination of factors, typically including older age, nutrient deficiencies due to eating the poor diet, existing health conditions and others. The main causes of osteoporosis include non-avoidable factors, advancing age/aging, hormonal changes and imbalances, especially menopause in women. Ethnicity. Europeans, whites and Asians are at the higher risk. Being tall and/or slim. Genetic factors. The family history of the condition. History of medical conditions such as autoimmune disorders, pulmonary disease, kidney or liver diseases. Avoidable factors, which are dependent on your diet and lifestyle choices, include eating disorders, anorexia or bulimia, drinking too much alcohol, excessive tobacco smoking, deficiency in nutrients like vitamin D, magnesium, and calcium, a sedentary lifestyle, inactivity, or too little exercise which helps to maintain bone mass. Long-term use of certain medications, including proton pump inhibitors, PPIs, selective serotonin reuptake inhibitors, SSRIs, aromatase inhibitors, fertility drugs/hormonal medications, anti-seizure medications and steroids, glucocorticoids or corticosteroids. high amounts of emotional stress and depression, weight loss, dieting that results in severe calorie restriction and malnutrition, autoimmune diseases including rheumatoid arthritis or lupus, multiple sclerosis, or ankylosing spondylitis, hematologic blood disorders, female athletic triad, irregular/absent periods, or premature menopause, AIDS/HIV, chronic kidney disease, polio and post-polio syndrome, scoliosis, spinal cord injuries. Symptoms of osteoporosis. There typically are no symptoms in the early stages of bone loss. But once your bones have been weakened by osteoporosis, you may have signs and symptoms that include back pain, caused by a fractured or collapsed vertebra, compression fractures in the spine causing loss of height over time, the stooped posture. The compression of the vertebrae may also cause a slight curving of the upper back. The stooped back is known as kyphosis, or more commonly, widow's hump, a bone fracture that occurs much more easily than expected. Receding gums. Your gums can recede if your jaw is losing bone. Weaker grip strength. In a study of postmenopausal women and overall bone mineral density, researchers found that hand grip strength was the most important physical factor. Weak and brittle fingernails. Nail strength can signal bone health. Back or neck pain. Osteoporosis can cause compression fractures of the spine. These fractures can be very painful because the collapsed vertebrae may pinch the nerves that radiate out from the spinal cord. Diagnosis of osteoporosis. The doctor will consider the patient's family history and their risk factors. A scan, to measure bone mineral density (BMD). Bone density scanning uses a type of X-ray technology known as dual energy X-ray absorptiometry (DEXA) and bone densitometry. Combined with the patient's risk factors, DEXA can indicate the likelihood of fractures occurring due to osteoporosis. It can also help monitor response to treatment. Two types of device can carry out a DEXA scan: a central device. A hospital-based scan measures hip and spine bone mineral density while the patient lies on a table. A peripheral device. A mobile machine that tests bone in the wrist, heel, or finger. The results of the test are given as a DEXA score or a Z-score. The T-score compares the patient's bone mass with peak bone mass of a younger person. -1.0 or above is normal. From -1.0 to -2.5 suggests mild bone loss. -2.5 or below indicates osteoporosis. The Z-score compares the patient's bone mass with that of other people with similar build and age. The test is normally repeated every 2 years, as this allows for comparison between results. Diet for osteoporosis. Good nutrition and regular exercise are essential for keeping your bones healthy throughout your life. Men and women between the ages of 18 and 50 need 1,000 milligrams of calcium a day. This daily amount increases to 1,200 milligrams when women turn 50 and men turn 70. Good sources of calcium include low-fat dairy products, dark green leafy vegetables, canned salmon or sardines with bones, soy products, such as tofu, calcium-fortified cereals and orange juice, collard greens, turnip greens, kale, okra, Chinese cabbage, dandelion greens, mustard greens and broccoli. Some dairy products are fortified with vitamin D. Fatty varieties of fish such as salmon, mackerel, tuna and sardines contain vitamin D. Protein is one of the building blocks of bone. And while most people get plenty of protein in their diets, some do not. Vegetarians and vegans can get enough protein in the diet if they intentionally seek suitable sources, such as soy, nuts, legumes, and dairy and eggs if allowed. Older adults may also eat less protein for various reasons. Protein supplementation is an option. Drinking heavily can lead to bone loss. Limit alcohol to no more than 2-3 drinks per day. Coffee, tea and soft drinks sodas contain caffeine, which may decrease calcium absorption and contribute to bone loss. Choose these drinks in moderation. Treatment of osteoporosis. Although you can't completely reverse osteoporosis, there are ways to manage it. Osteoporosis treatment may involve medication along with lifestyle change. Hormones, such as estrogen, can play a role in osteoporosis prevention and treatment. However, there has been some concern about potential side effects tied to the use of hormone therapy. Kyphoplasty is a surgical treatment for fractures. Kyphoplasty involves using small incisions to insert a small balloon into the collapsed vertebrae to restore height and function to the spine. Specific drug treatments include bisphosphonates, denosumab, parathyroid hormone therapy, SERMs selective estrogen receptor modulators. If you liked the video, please subscribe, like, comment or share.